guys, Dr. Jeff LaCour from NOHS ENT and Allergy, and this is...
Hi, I'm Mandy. I'm the Vestibular Physical Therapist here at NOHS Rehab.
And today we wanted to talk to you about dizziness. A lot of patients don't know where to go when they're feeling dizzy. Sometimes they'll say, oh, I'm just getting old. And I'm like, that's nonsense. And so if you're having symptoms such as vertigo, or when you lie down and roll over, you feel like the room is spinning, or sometimes you go to the store and you just feel off, like you've had too much to drink and you've had nothing to drink, okay? It's a good indication that you should come in and see an ear, nose, and throat doctor, because when you come in, we'll evaluate your reflex between your eyes and your inner ear. And if that's off, then I'll put in a referral to Mandy, who'll take over from there.
Right, so first I should probably explain what vestibular rehab is, because it is a new concept to a lot of people. It's specialized physical therapy designed to resolve vertigo and dizziness, improve balance, and decrease fall risk.
And this is great because literally we're the only facility that I know of on the North Shore that actually specializes in balance. Again, most patients don't even know where to go, and they'll come in and they'll say, well, I'm just a little off. And what's great is I'll send them over to Mandy, and Mandy will run them through a bunch of tests and give them a score. So let's say they score like an 85 on their first test. Then after 4 or 5 visits with Mandy, they'll score like a 95, and they'll come in feeling more confident and less likely to fall.
Definitely, and a lot of people will ask me, how does physical therapy help with my dizziness? So vestibular physical therapy is actually individualized per person. So it depends on your complaints and your diagnosis. For instance, if somebody has BPPV or positional vertigo where the room is spinning and the crystals in the inner ear are out of place, there's a specific maneuver we can do to get those crystals aligned and decrease the vertigo. And also, if someone is suffering from dizziness or imbalance from any other vestibular disorder, we can run the tests and see what they need, and then we can do specific exercises and balance training to strengthen that vestibular system up so that they no longer have the dizziness or imbalance.
And this is great. It helps us out a lot as ENT physicians because they'll go and see Mandy and they'll come back, and then we can kind of work with some of the other problems such as Meniere's disease. That's an inner ear disorder where there's too much fluid on the inner ear, or inner ear migraines. A lot of people don't even know that exists, and they say, well, I don't have a headache, but that doesn't mean you can't have an inner ear migraine. And a lot of those patients just feel off most of the time. And so it really helps a lot to be able to work with Mandy and to kind of just really bring it together for these patients.
Definitely, and we have a ton of success stories. The people in the program, their vertigo is resolved, their dizziness is less, their balance is better, their confidence is increased, so their overall quality of life is improved, and that's really what it's all about.
And it's super helpful when a patient calls up and maybe my clinic is completely booked, and I know that their crystals are out of whack, and so I'll say, Mandy, can you get them in, please? And literally, they'll get them in, reposition their crystals, and they're good to go.
Yeah.
So by all means, this is something that we want to bring more awareness to because not a lot of patients know where to go. So please give us a call, NOHS ENT and Allergy. We'll evaluate you, and then if we think you'd benefit from therapy, we'll send you on over to Mandy.